There's no excuse for it. And I take full responsibility for making sure it gets fixed ASAP. Look, there's no denying it. Right now, the website is too slow. Too many people have gotten stuck. And I am not happy about it. So let's look what's happened. Today, the Affordable Care Act requires insurance companies to abide by some of the strongest consumer protections this country has ever known, a true patient's Bill of Rights. Quality, private insurance plans for the 15% or so of Americans who don't have health care, and for the 5% of Americans who have to buy it on their own and they're not part of a group, which means they don't get as good a deal. And this new marketplace was built on the Massachusetts model. It allows these Americans who have been locked out to get a better deal from insurers. They're pooling their purchasing power as one big group. And insurers want their business, which means they give them a better deal. And they compete for that business. And as a result, insurers in the marketplace, they can't use your medical history to charge you more. If you've been sick, you finally have the same chance to buy quality, affordable, not only the uninsured, but also the underinsured. And there are a number of Americans, fewer than 5% of Americans, who've got cut-rate plans that don't offer real financial protection in the event of a serious illness or an accident. Remember, before the Affordable Care Act, these bad apple insurers had free rein every single year to limit the care that you received or use minor pre-existing conditions to jack up your premiums or bill you into bankruptcy. So a lot of people thought they were buying coverage, and it turned out not to be so. Before the Affordable Care Act, the worst of these plans routinely dropped thousands of Americans every single year. And on average, premiums for folks who stayed in their plans for more than a year shot up about 15% a year. Now, if you had one of these substandard plans before the Affordable Care Act became law, and you really liked that plan, you were able to keep it. That's what I said when I was running for office. That was part of the promise we made. But ever since the law was passed, if insurers decided to downgrade or cancel these substandard plans, what we said under the law is you've got to replace them with quality comprehensive coverage. Now, unfortunately, there are others that are so locked into the politics of this thing that they won't lift a finger to help their own people. And it's easy to scare folks. And it's no surprise that some of the same folks trying to scare people now are the same folks who've been trying to sink the Affordable Care Act from the beginning. The old broken system, as if it was working for people. Anybody who thinks we shouldn't finish the job of making the healthcare system work for everybody, especially when these folks offer no plan for the uninsured or the underinsured or folks who lose their insurance each year, when the governors of a bunch of states and half of the Congress aren't trying to help. Yeah, it's both parties working together to get the job done. That's what we need in Washington right now. That's what we need in Washington right now.